Okay, so I'm Ian Harvey. I am a massage instructor in Pensacola, Florida. Today we're going to be working with plantar fasciitis. If you don't know what this tends to present as severe pain, usually shooting in the bottom of the foot. That's the plantar surface of the foot, usually closer to the heel, but it can manifest in a bunch of different ways. It can be felt in the arch, in the ball, or all of the above. In the case of our current client, it's all of the above, and it tends to be more on the medial side. That's not necessarily going to change my treatment strategy too much, because in the intake, I found out, to no surprise whatsoever, that she has frequent cramping in her posterior low leg, so Charlie horses. And I find this very often. If the client has plantar fasciitis, there's also some sort of dysfunction in the posterior low leg. So I'm going to be working with this leg, with this foot specifically, but I'm not going to stop there. I'm also going to work with this calf. If this calf remains too tight, then this plantar fasciitis is never going to resolve itself. So let's talk about how to work with the foot specifically, and then we'll work with the calf. I could work in the other direction. All that matters is that I work globally and not just where the pain is. Working with the calf first might afford me a little more flexibility in the foot, but I don't think that the order is too important for this treatment. So do let me know if any of this is ever painful. Track your client closely with this. Some people can take a huge amount of pressure in their feet with plantar fasciitis. Some people, just any little bit can be too much. So with them, I would start with the low leg, and I would probably start very broad. In this case, I'm going to start at about my medium pressure. I'm going to palpate the foot as I move it. I'm going to feel for tightness in any given direction. As you work on this foot, change the shape of that foot. I'm going to be pronating and supinating it, and that's going to cause the bones to massage the soft tissue. It's not just me pressing in and jamming my finger where the muscles don't want fingers to go. It's working with the foot as it is. Well, I am using my thumbs for this. I'm not mashing in using the muscles of my hand. I'm creating a certain shape with my hand, and then I'm moving my arm. That's a much more stable way of using the thumb than trying to do a whole lot of swiveling here at this thumb joint. And so I'm working from a myofascial perspective. So while I am occasionally pressing in at a 90-degree angle, most of my pressure is oblique at a 45-degree angle. I'm thinking, how can I spread this plantar fasciitis? How can I lengthen it? So with myofascial release, one strategy is to create deformation, to create a change in the shape of the fascia, and then hold. And wait for melting to happen. The fascia will change consistency, even if it's only temporary, and that can be very useful. At the same time, my hands are pouring heat into this surface. I'm creating inflammation, and that's pouring more heat into this. And we're going to change how this foot interacts with itself, because it's been in this pattern for too long. We need to change this pattern. I don't have a specific new pattern in mind. I'm not a rolfer. I don't know much about that stuff. All I know is I want this fascia to loosen up. I want it to loosen up in a bunch of different directions that it's not used to. And then I'm going to rely on the client to strengthen and loosen this fascia in a positive new way once I'm done. I can only do so much as the massage therapist. A lot of this stuff is going to be up to my client. With anything having to do with extremely tight structures, I take the chance to become still far more often. Mm-hmm. If things are twitchy, if they're painful, I slow the hell down.
Like you're just using this hand to cradle.
Exactly.
Foot, right?
Just
hold it in place.
Mm-hmm. I'm applying comfort with this right hand, And I'm also, anytime that I do any move where I mobilize, this is helping, this bar.
So-
And it gives me pressure in the opposite direction, like I'm
Wringing it.
wringing it out, exactly. So now that we're working with the posterior low leg, we want to lengthen and broaden, and we also want to work with the position of this foot relative to the attachment sites up here. We want to work with soleus, which is deep to gastrocs here, and we want to work with gastrocnemius. And if you work over here with these lateral low leg muscles too, that can only help. Okay. So for lengthening, I'm going to get behind my hand. I want to sink into the tissue and I want to wait. I don't have any lubrication right now. Go ahead and take some easy deep breaths. So I'm sinking in with the heel of my hand, and that's working in this fascia. If you look at a muscle chart, you'll see a lot of white, thick fascia down here that hooks directly into the heel, and then that becomes the plantar fascia. This fascia I'm working on right here is continuous with the plantar fascia. They're one and the same. If I can get this to calm down, all the better. It's going to help down below. And as with any chronic inflammation condition, track your client. If anything's too much, go broader, use a broader tool, and go slower. Okay, and this is a trick, what I'm about to do here. It doesn't work for everyone because it can be painful to the knee. And do let me know. I'm going to bring the leg laterally, and then I'm going to wrap it in the sheet. And I can compress the foot, I can dorsiflex the foot as I work with this posterior tissue. And I'm just going to softly rock the foot. I'm not going to try to create a lot of new range of motion in this ankle. I'm just working with the fascia as it slides. There's going to be a lot of muscles sliding past each other as this happens. And I'm pinning certain layers of fascia in place as it happens. This can be a gliding move or it can be a static move. And of course, do some nice spreading in here. We want this gastroc and the soleus to be able to slide with a little bit of independence. We want them to be able to relax. I'm promoting a lowering of tone in this low leg. And while that's only temporary, this is going to give her a good head start if she were to start stretching and doing specific strengthening exercises. This is going to put her in a better place to succeed and get a reduction in pain. Okay, so there's other stuff that I could do with this low leg, but if you can calm down this posterior low leg and work with this foot tissue, then you're going to make a lot more progress than if you just mashed into this foot. So give this a try, let me know how it goes, leave me some comments. Thank you so much.